A bulbous nose is characterized by a rounded or wide nasal tip that can make the nose appear heavier and less defined. This is usually related to cartilage shape, thick skin, or a combination of both. In this video, we explain what a bulbous nose is, what causes it, the main surgical and non-surgical treatment options, and what patients should realistically expect in terms of results and safety. A bulbous nose refers to a nasal tip that appears broad, rounded, or heavy. This shape is usually caused by the structure of the lower nasal cartilages or by thicker skin covering the tip rather than by the nasal bones. Because the contours are less defined, the lower part of the nose may look fuller or slightly droop when smiling. Understanding whether the cause is cartilage structure or skin thickness is essential when choosing the most effective treatment. A bulbous nasal tip usually develops due to a combination of anatomical and skin-related factors. Genetics often play the largest role, influencing the shape and width of the nasal cartilage. Wide or convex alar cartilages can create roundness, while weak cartilage support may reduce projection and definition. Thick or sebaceous skin can also obscure the natural contour of the tip. In some cases, aging or conditions such as rhinoplasty can further increase the fullness of the nasal tip. The treatment approach depends on the underlying cause and whether a permanent or temporary improvement is desired. When cartilage structure is responsible for the rounded shape, rhinoplasty provides the most precise correction by reshaping and supporting the nasal tip. For patients seeking a less invasive option, non-surgical rhinoplasty using dermal fillers can improve nasal contour and create the visual effect of a slimmer tip, although the result is temporary. Rhinoplasty for a bulbous nose focuses on refining the lower third of the nose where the tip is formed. The procedure is typically performed under general anesthesia and lasts around 40 minutes in less complex cases. During surgery, the surgeon reshapes the lower nasal cartilages and may place fine sutures or small cartilage grafts to improve definition and support. As swelling gradually decreases, the nasal tip becomes slimmer, more defined, and better balanced with the rest of the face. A non-surgical nose job uses hyaluronic acid fillers to refine nasal contours without altering the underlying cartilage. By placing filler strategically along the bridge and tip, the nose can appear straighter and more defined. The treatment takes only a few minutes, requires no downtime, and results are visible immediately. However, the effect is temporary and usually lasts between 8 and 12 months. Before and after results for bulbous nose correction typically show a more defined nasal tip and improved facial balance. During the early healing phase after rhinoplasty, mild swelling or temporary congestion is normal. As the tissues settle over the following weeks and months, the tip gradually becomes more refined. The goal of treatment is always a natural result that harmonizes with the patient's facial features. When performed by an experienced surgeon, nasal tip rhinoplasty is generally a safe procedure. Temporary effects may include swelling, bruising, mild numbness, or nasal congestion during the early recovery period. Less common complications can involve persistent swelling, asymmetry, or functional issues if the nasal structure is not adequately supported. For this reason, choosing a qualified surgeon with specific experience in nasal tip surgery is essential. A bulbous nasal tip is not simply a matter of size, but of shape, balance, and definition. The most effective treatment depends on the underlying anatomy and the degree of correction required. If you're considering nasal tip surgery for a bulbous nose, visit our website to request a free personalized consultation with our team and receive a treatment plan tailored to your case.